Let her ask JKR to review a award of 118 PhDs, and I'll be privileged to maybe pick the brains of some of scholars here to just tell me a bit of this as far as, because also this really goes to show the way our system also is really gamed and the way people are taking advantage of the loopholes in our system. How watertight is it as far as awarding PhDs is concerned? Peter Kagwanja, briefly.
Well, the issue of let's start with cancer, and I think we need to revisit one of the pillars of President Uhuru Kenyatta, which is affordable health care. And I think this is the time to reflect on it, because the public clamor, as you can see from people daily, is that this need to be declared a national disaster. Or kind of an emergency. And the reason given is that it is taking a high toll on the people. And the disease itself is beginning to become an equal opportunity killer, because it's not just killing the wealthy, it's also killing the poor. Perhaps more the poor, because they're the ones who don't have access to the early tests so that they can deal with it. And even when that comes, they don't have the resources to go to India and elsewhere people are going. So in that regard, cancer is basically a scourge. But that said, the question is, we know malaria comes from mosquitoes. We know where these other diseases are coming from. About cancer, it's a mystery to many people. And it is not one disease. Some say this is colon, this is where, this is heart, this is liver, this is where. It is attacking parts of the body, so to say. And therefore, it is more about looking at revisiting that pillar from the affordable health care to more knowledge about our health. We need to create awareness about our health, because this is a lifestyle disease that has much to do with what we are eating and where we are living and how we are living. Why are small countries like Cuba not victims of this particular scourge in the way we ourselves are becoming part of this? The kind of lifestyles we have adopted, where you're eating beef from morning, 3 meals a day, because you can afford it, and 7 days in a week, and therefore 365 days in a year. The excesses of our life, you're on pizza, when you know the so-called processed foods, as it were. I'm not a health expert or nutritionist in this regard, but they're basic things that you do know. Why we managed to contain this problem within our neighborhoods when we were growing up, within our own communities, was because of the kind of food we ate. We ate food that was fresh from the gardens, that was not pumped with chemicals in it, and therefore our bodies are reacting to some of the things that we're doing. So can we then therefore revisit this pillar, the health pillar, beyond affordable health? Can we have knowledge of our own health? Can we take charge of our own health as individuals in terms of what we eat, where we live? A friend of mine, and I say this and I stop, from Garissa, told me that a friend of his was condemned to pass on because the cancer was too deep and could not be cured. And the result, the response was, go home and feed the way our ancestors used to feed. So you fed on camel milk.
Yes.
You fed on fresh, natural things. And according to him, this person came back came back to Nairobi, and she is living well and happy. Whatever the veracity of that story is, the argument is that we need to go back to our roots in terms of what we eat and how we live.
Thank you. Let's say from Ambassador Erastus Mwancha briefly, or Hassan Khaneje, you ready?
I don't think we did talk enough actually about the epidemic that is cancer today. Now, Prof just mentioned that we know how these other diseases come. We know what causes malaria and everything else. One thing that I would like to ask, and perhaps institutions that are involved, especially in health sciences, should go out there and deliberately try to do. is there something that has come into a market that we're consuming that's actually causing this? Now, we know, for instance, after the Gulf War, the first Gulf War and the second Gulf War, that the use of depleted uranium or depleted plutonium in Iraq increased the cases of cancer within that country and for American soldiers who actually went back to the United States. You understand? So a lot of it, we know how some external factors can actually play into this. When I talk about external, I'm talking about something that's not exactly inherent in you. You are not exactly born with it, but something you get exposed to. Now, is there something we are consuming? Are there chemicals we're using in our foods that are increasing this? Number two, if you have discussions, especially with a lot of doctors, there are certain places in this region where the cancer incidence has risen.
Yep.
There has to be a reason. There has to be something that is causing that. Are we doing sufficient research? I would suggest we actually invest enough money to do not just the screening of it, but also to look at why a sudden increase in incidences of cancer. Number two, provide enough equipment and resources and, of course, the training necessary for the doctors to be able to do early screening. Some of the screening, if they're established early that you have cancer stage 1 or something like that, they can be treated. But a lot of times, including those who are healthy, they actually have money. By the time you start feeling sick, you're already in an advanced stage. Pretty much you cannot come back. Of course, there are those types of cancer that are extremely serious and extremely aggressive, which either way you can't really come back. But a lot of them, they can actually be managed, and advanced countries do this pretty well. And so can we invest some resources in actually this line, doing some research, doing some screening, but especially the research part. And as someone who also has a chance to interact with a lot of physicians, there are hospitals right now where, actually most of them, I think, cancer is killing more people than HIV/AIDS. And it's not just about the rich. It's an equal opportunity thing. It's killing across. So that is something as a government, I think we should invest in and try to find out what is causing this, how can we screen our people, and how can we address it before it actually harms most people in the country.
Thank you.